Hello again, and welcome back to Distributed Dialogues, the podcast about decentralized technology and how it affects the world around us. I'm Graham Peterson.
And I'm Dave Hollerith.
Support for Distributed Dialogues comes from ButcherBox, providing high-quality, humanely raised meat directly to your door. Order today and get $20 off, 2 free filet mignons, and free bacon in your first box. This is a limited-time offer, so act fast. Visit butcherbox.com/distributeddialogues to claim this amazing offer. Again, that's butcherbox.com/distributeddialogues.
Over the past 6 episodes, we've covered stories about how decentralized tech might fit into the American healthcare system. Today, we're coming at a slightly different perspective. To understand where the current system comes from and where it could be going, we're going to be looking at arguably the healthcare sector's most important location, Nashville, Tennessee.
Quick side note, Distributed Dialogues is actually located in Nashville. It's our home, so makes this episode kind of personal.
It also means we didn't get turned down for as many interviews. So these days, Nashville's notorious for bachelorette parties, the vibrant music scene, the Predators hockey team, the Tennessee Titans, and the infamous hot chicken.
People who actually live in Nashville don't get the super hot chicken. They keep it mild, all right? We stay alive. Let the tourists suffer.
With a population of almost 700,000 people, Nashville is a mid-sized city that has grown exponentially in the last decade. There are many reasons why Nashville has been growing so fast. It's a cultural hub, after all, essentially the home and resting place of the country music industry.
At least what's left of it.
Nashville also has a pretty low unemployment rate, 2.7% compared to the national average of 4%. It has historically had a low cost of living, a budding tech scene, several universities, and like we said from the beginning, in this town, healthcare is king.
It's huge.
Absolutely huge. Today, Nashville healthcare companies employ 500,000 people globally, and Nashville's annual revenue from healthcare alone is $84 billion.
It's incredible. One reason why Nashville is doing so well today might be because the city caters to industries which are largely more stable and recession-resistant than, say, journalism or other forms of media enterprise. Do I need to get my resume updated? Anyway, the 2008 financial crisis didn't hit Nashville the same way it hit other parts of the country, and that was largely due to the healthcare industry. So why are there so many healthcare businesses operating out of Nash Vegas?
Nashville is arguably the epicenter for the biggest disruption to happen to healthcare in the last century. It all started with the founding of the Hospital Corporation of America, or HCA. Before HCA, hospitals in the U.S. were mostly not-for-profit. In fact, it wasn't until the 1930s that the insurance company Blue Cross started offering private healthcare coverage in dozens of states as a direct response to the Social Security Act. You see, the Social Security Act that was put into place during the Great Depression was intended to help the unemployed. However, it did not cover healthcare.
Even as the number of health insurance companies grew, by the 60s, many people outside of the workforce still couldn't afford it. This led to the Medicare and Medicaid Act to be passed under President Lyndon Johnson. Because this act essentially gave insurance to everyone over 65, this led to an enormous market opportunity. Healthcare could become profitable.
Essentially, HCA was one of the first hospital companies to commoditize healthcare. Some people say this act has made healthcare in the U.S. both pricier and misaligned, driven by investor outcomes instead of patient outcomes. Others believe it has brought more accountability to the market and allowed private businesses to compete against government-run behemoths. HCA was started by 3 people owning one hospital. Today, it owns or operates more than 170 hospitals, 100 surgical centers, and has spun off numerous other large healthcare businesses, many of which call Nashville home.
All of which have added to Nashville's underlying status as a mecca for healthcare.
To dig in further, we sought out the help of 2 Nashville-based healthcare reporters, and we wanted to ask them, given the city's past for disrupting healthcare, what could we expect in the future?
One of those reporters is Blake Farmer. He's the senior healthcare reporter with Nashville Public Radio.
It all goes back to HCA, and it's because there have been so many different iterations where they've, spun off a batch of hospitals that are now run by another company. I mean, there's a company called LifePoint that is a batch of HCA hospitals that spun off and became a group of hospitals that specialize in rural settings. There's so many companies that sort of emerged that were sort of serving HCA and now serve other clients. And so the facilities, that's sort of where people get their start. I mean, I can't tell you the sort of biggest entrepreneur names in town somehow were in the hospital business at some point. So the origins of the healthcare industry in Nashville were hospital based, but I think the future is technology based. So long as the existing industry sort of gets on the technology train, which it appears to be doing, but I think the fear a lot of people had is that somebody else would figure it out, who wasn't, a part of this system and sort of blow it up. But I think more likely you're going to see, let's say an Amazon come in and maybe partner with an HCA and figure out how to streamline some things. There could be great opportunity rather than, kind of being this intimidating force that's in town. But the Amazon piece is a huge question mark in my mind. But, I think we likely continue to see, folks sort of coming to town with tech ideas, and I think some of them will kind of go nowhere, and many of them will kind of start to be adopted. I think the interesting thing about healthcare is that there's not been a lot of just massive change. I mean, if you think about the healthcare industry, let's say the way Amazon has transformed so much of retail, you haven't quite seen something like that in healthcare, where you look at 10 years ago and, wow, we were doing things totally differently. That's not how things have been. Big changes in healthcare are not that big if you were looking at another industry, and it's because there's so many complicated pieces to the puzzle, but who knows? There could be some grand idea out there that really transforms. I think if you looked at Amazon, for instance, you would not have foreseen. I mean, they were selling books when they started. You would not have foreseen them being the biggest server provider in the country. I mean, it's so I don't know what we don't know.
Listening to Blake, it becomes pretty clear that right now, the hottest piece of news to speculate on in the city is that Amazon is coming. That's right. Amazon's coming to Music City. Yeehaw!
Wait, am I supposed to be excited or... moving on. One of the big questions many Nashvillians have right now is whether or not they should be excited about Amazon's move here. Personally, I'm interested to see what happens with the already booming housing market.
The investment Amazon is putting into their future Nashville office is previously valued at $230 million. It's reported that this project will create an additional 5,000 jobs for the city, with an average wage of $150,000. In addition, Amazon will receive $102 million as performance-based incentives for creating those jobs. Based on this information, it's predicted that the state, county, and city could earn more than $1 billion in incremental tax revenue over the next decade from the project.
We're not 100% sure what portion of these jobs will go to existing Amazon employees, Nashville residents, or other transplants. Either way, the average wage of $150,000 seems a bit lofty to me, especially when you compare that with 5,000 new jobs. I would bet that most of these positions will not be executive-level positions, and most definitely not in the six-figure range, or anywhere even close. To get a better understanding of why Amazon has decided to move to Nashville, we spoke with Nashville Business Journal reporter Joel Stinnett. Here's what he had to say.
I think there's several reasons. The fact that it's an operations hub and they'll be dealing a lot with logistics. Nashville has a central location. If you look at the geography, it's interesting that FedEx is headquartered in Memphis, just south of Nashville, and UPS's delivery services are headquartered in Louisville, just north of Nashville. Mm-hmm. So I think it's a central location for the city as well. They said they're excited about the fact they can recruit talent here.
Yeah.
Nashville's very very popular right now as far as being able to bring in tech and tech talent from areas outside of the Tennessee.
Mm-hmm. Yeah, and so do you think? So I'm kind of wondering what is going to happen as far as do you think Amazon is planning on getting into healthcare?
That's something I've asked just about all my sources on anytime I meet with somebody lately, and the general consensus I've gotten is that they think there's definitely a possibility that could be one of the reasons for the move. Last year, everyone knows with Berkshire Hathaway and J.P. Morgan, Amazon started their own healthcare company. Mm-hmm. So it makes sense that if you're looking for healthcare talent, Nashville will be the place to come with all of the hospital companies and the health tech companies that are headquartered here. It remains to be seen if that's really their motivation, but I think it's definitely a huge possibility. From a healthcare perspective, what we're going to see, and this is pure speculation, but I think there's a lot of opportunity for things like, right now Amazon sells home healthcare goods on its website. Mm-hmm. One of the opportunities, hospitals have value analysis committees that usually decide what they're going to buy for a hospital. All right, they're usually made up of the CFO, a few different doctors or surgeons, and they kind of determine what the hospital buys. The way the process works is a doctor will come in and say they want to buy a certain medical product. Mm-hmm. And it's usually a 9-month process for them to go through the paperwork and through this value analysis committee to decide what they're actually going to buy. There's a couple companies here in Nashville that are trying to address that and speed it up. They have different software platforms for that. But that's one area where Amazon could be looking to get into, is to be able to not only supply just your normal Band-Aids and things like that you would want for your house, but actually supply medical devices and equipment to hospitals. Something that I think would be really interesting is they recently bought Pillbox, which is it's a prescription company. If they were able to buy a telemedicine company to go along with that, in theory, you could see a doctor on your phone for your flu or your cold. He could prescribe you something, and Amazon could deliver your prescriptions to you without you ever having to leave the comfort of your home in a matter of hours. But as far as an impact on the city, though, I mean, you mentioned traffic. We recently did a story where the Nashville Yards towers, where Amazon's going to be located, mm-hmm. expected to generate more than 34,000 car trips a day through downtown Nashville. So, I mean, it's going to have a huge impact on traffic here. It's only going to get worse. Another thing I don't think people realize is, this announcement came on the heels of their announcement of their HQ2, which was split up between New York and D.C. Yeah. Those were 25,000 jobs each. The operations center here in Nashville is expected to be 5,000. Mm-hmm. But if you break it down in terms of workforce, if all those Amazon jobs were filled, all 5,000 were filled in Nashville today, 1 out of every 200 people in Nashville's workforce would be working for Amazon. But if you did the same thing in, say, New York City, take all of New York City's workforce, with those 25,000 jobs, only 1 of every 400 people in New York City will be working for Amazon. So even though it's a fifth of the jobs, it's going to have twice the impact here in Nashville. I think people don't really realize how it's the largest jobs announcement in the city, in the history of Tennessee. It's going to be the largest private employer in Nashville. It's going to have a huge impact going forward on the way it impacts the city.
Even though much of what people are saying right now is speculative, there are a lot of interesting possibilities with what could happen when Amazon comes to Nashville, not only for the city itself, but for healthcare. For instance, Change Healthcare, one of the largest healthcare administrative networks in the United States, has been using Amazon Web Services to host their cloud-based infrastructure, which processes millions of confidential transactions per day.
And guess what? It's blockchain enabled.
We don't know anything more about this, do we?
Nope, but I can say, Dave, we have top men looking into this. Top men. Distributed Dialogues is a BTC Media-produced podcast on the Let's Talk Bitcoin network. Visit letstalkbitcoin.com for more engaging podcasts, and make sure to follow us on Twitter @DistributedDD for all the latest news and episodes. Thanks again for listening. We'll see you next time.